Considering hysterectomy? By Hysterectomy911.com, www.hysterectomy911.com. Are you considering undergoing hysterectomy? Here are some things that you should know so you can determine if hysterectomy is right for you. Alternatives to hysterectomy. Hysterectomy is usually the last resort a doctor takes in the treatment process. If other alternative treatments fail, then hysterectomy might be the procedure that would provide the cure. Here are some of the alternative treatments before you consider hysterectomy. Balloon therapy. In this in-office procedure, a balloon is inserted into the uterus through the cervix. Once in the uterus, the balloon is inflated for 8 minutes with hot water, with the goal of destroying the endometrial lining of the uterus. This lining is believed to cause the bleeding. However, this procedure is not for women who want to become pregnant. Ablation. This is an outpatient procedure used to treat excessive bleeding. In this hysterectomy alternative, an instrument to destroy the uterine lining is inserted into the uterus through the cervix. This will end the bleeding. Again, though, this procedure is not meant for women who would like to get pregnant. Myomectomy. A myomectomy is an outpatient procedure used for the removal of fibroids. This procedure is performed by inserting a telescopic instrument through the cervix in order to remove the fibroids. However, if the fibroids are too large, then small incisions may need to be made on the abdomen through which the fibroids can be removed. Medication therapy. Doctors may prescribe medicines to treat causes and symptoms of problems with the uterus. Pain relievers can also be used, while hormone therapies may alleviate symptoms of endometriosis. Nerve block. This procedure is used to treat or relieve chronic pain. In this hysterectomy alternative, anesthesia is injected into the nerve that transmits the pain messages to the brain. The nerve is seemingly blocked to prevent it from communicating the pain messages. This is also an outpatient procedure and is temporary. However, this procedure can be repeated. Uterine artery embolization. This procedure performed by a radiologist blocks the blood supply to a large fibroid uterus. This can result in reduction of pelvic pain, bleeding, and uterine size. For some women this can be a permanent solution, but for others just temporary. Usually, uterine artery embolization is performed on women with medical reasons not allowing for hysterectomy. Hysterectomy tests. If the alternative treatments do not work, then hysterectomy might be the proper treatment for you. However, you must first undergo the following tests. Complete blood count. This test is performed in order to identify possibilities of treating anemia. Pap smear. Pap smear is performed to determine if there are signs of cervical cancer. Pelvic ultrasound. This test enables the doctor to look inside the pelvis and the organs within. Complete pelvic exam. This exam is performed to identify possible disease in any of the pelvic organs. Decision on the removal of the ovaries. Aside from the medical tests that you need to undergo prior to hysterectomy, you must also decide, with advice from your doctor, whether you want your ovaries removed during the hysterectomy. www.hysterectomy911.com. Copyright 2009. All rights reserved.